Good morning, everyone. My name is Emmanuel Rosigi from New Jersey Prevention Network, and I work with Tobacco-Free for a Healthy New Jersey, and I'm the Central Regional Coordinator for our tobacco point of sale and housing initiatives. Welcome to our Tobacco-Free Tuesday webinar titled Building Health Building Healthier Communities, Achieving a Tobacco-Free Designation Through Sustainable Jersey with Policy and Points. We want to thank everyone for joining us this morning. I want to let all of our attendees know that if you do have any questions, please put your questions in the chat and we will answer all the questions at the end of the webinar. Also, for those of our attendees who would like to receive CEU credits for participating in our webinar, there would be an evaluation link in the chat for our attendees to complete towards the ending of the webinar. And now I will be introducing Samantha McGraw from Sustainable Jersey, and she's the Senior Department Administrator.
Great, thank you so much for having me today. Definitely excited to present a little bit more about Sustainable Jersey for those of you who may not be super familiar with the organization. Again, my name is Samantha McGraw. I'm a Senior Department Administrator with Sustainable Jersey. I manage the organization's core operations, which include the Municipal Certification Program. And this involves providing direct support to municipalities, completing the intake of applications for certification, and coordinating the action review process. Next slide. So what is Sustainable Jersey? So for those of you who may not have heard of us before, we are a nonprofit organization that's administered by the Sustainability Institute at the College of New Jersey that provides tools, training, financial incentives, and technical assistance to support communities as they pursue sustainability programs. In October of 2014, Sustainable Jersey for Schools was launched in partnership with the New Jersey School Boards Association and other statewide educational organizations to certify public schools. So if you aren't already working with your schools, please think about doing so. We also offer grants and technical assistance to participating municipalities to support activities that contribute toward the completion of Sustainable Jersey actions. And since 2009, we've provided over $8.4 million in grants to communities for sustainability initiatives. Next slide. So you might also be interested to know that Sustainable Jersey is a national role model and founding member of the Sustainable States Network, which includes 12 state participants. These are states with similar but slightly different programs to Sustainable Jersey. If you'd like to learn more about them, you can read our report, Statewide Change, One Community at a Time, that's posted on our website. And the connection with these other states is a really great learning and networking opportunity to help make all of our programs stronger. Next slide. So these are just some of the statistics for our municipal program. As I mentioned, the program started in 2009. We currently have 83% of the municipalities participating, which encompasses 91% of the population. There's 186 municipalities that are certified, and collectively, municipalities have implemented over 18,000 different actions. Next slide. So what do these certification requirements look like? There's 2 levels of certification, bronze and silver. To attain bronze, a municipality needs to complete a minimum of 150 points, establish a green team, implement 2 priority actions, and complete actions in 6 categories. For the silver level, a municipality needs to complete a minimum of 350 points, establish a green team, implement 3 priority actions, and complete actions in 8 categories. Once certified, certification is good for 3 program years. So any municipality certified as part of the 2025 cycle will have their certification expire December 31st of 2028. Next slide. So what are some of those actions that municipalities can do in order to earn points towards their certification? So we have 17 different action categories that municipalities can choose from, encompassing what we see as the three pillars of sustainability: people, planet, and prosperity. Each town chooses its own priorities from this menu of actions. So some towns might be more concerned with transportation issues or stormwater management, while others are more focused on arts and culture or health and wellness. We also award points for innovation when towns create projects that aren't part of the current menu of actions. All of our actions come with a fully resourced tool with information about how to go about completing the action, what to submit in order to earn credit for it, and resources to help with completing the action. The actions are developed by task forces that comprise New Jersey state and local officials, experts, nonprofit groups, and members of the business community. And all of the actions are vetted with local government officials before they come into the program. So the Tobacco-Free Community Action can be found in the health and wellness category, which includes other actions such as anti-idling education and enforcement, actions related to lead, and a new action we released last year, townwide gas leaf blower restrictions. Next slide. So this is a map showing the municipalities that are currently approved for the Tobacco-Free Community Action. This map shows the approval at any point level. The Tobacco-Free Community Action is a variable point action, so it's not just those that qualify for the Tobacco-Free Community Designation. And the really great news is that the New Jersey Prevention Network has resources that are available to help you complete the action and increase your point totals, which I'm sure you'll hear about in a little bit. So, please utilize this great resource to help earn points towards your Sustainable Jersey application. Next slide. So what does the process of certification look like? So it's easy to get started. If your municipality is not already participating in the program, the first thing that it needs to do is register to join the program. This involves council passing a resolution, and we do have a template that's available on our website to do that. After registering, the municipality needs to form a green team to work on the certification and sustainability initiatives in the municipality. Then the town needs to implement enough actions to meet the minimum requirements for bronze or silver certification and submit an online application. And then certification is awarded after review and the verification of the application materials. Just to give you a general idea of the timeline, we have one annual cycle that consists of 3 rounds of submission and review. The first deadline for this year is coming up very soon, on February 23rd. And then the second deadline will be May 16th, and the final deadline is July 31st. But you can expect to follow that sort of time frame year to year. Municipalities can submit for the first time in any of the 3 rounds. However, we do highly recommend submitting in February and/or May so that you can get feedback on your submissions prior to the final deadline. And then all municipalities certified each year, along with our annual award recipients, are recognized at the Sustainable Jersey Luncheon during the New Jersey League of Municipalities Conference in November. We had a great event last year and was pretty much a sold-out crowd. So it's always exciting to see all the energy in the room after a long year of hard work. Next slide. So why might a municipality want to get certified with Sustainable Jersey? So municipalities can save money and get money by implementing different actions that lead to savings in energy, water, and waste. The program actions can help improve efficiency, cut waste, and stimulate local economies. And as I mentioned earlier, municipalities that are registered with the program do get access to the Sustainable Jersey Grants program. We also have access to training tools and expert guidance to help complete the actions. We frequently hold webinars on a variety of topics, sometimes specifically focusing on how to complete certain actions. We also post all of our webinar recordings, presentations, conference presentations, and in-person training presentations on our website. Another is recognition with community members, as well as on the Sustainable Jersey website, in our publications, and in the media at promotional events. Municipalities that are certified receive a customized Sustainable Jersey logo with their municipality's name on it that they can use for promotional materials. As I mentioned, we recognize all of our certified municipalities at our annual luncheon. And one of the awards that we give out is a Rookie of the Year recipient that goes to a newly certified municipality. So if you're thinking about moving forward with certification and it's your first time, you might want to make that your goal. And then lastly, making a larger impact by conserving valuable resources and protecting the environment. Residents increasingly want to live in towns that are doing their part for the environment. As I mentioned earlier, our actions cover a wide range of topic areas. So the municipality can really use it sort of as a menu to pick and identify the initiatives it wants to prioritize and focus on. Next slide. So in addition to our bronze and silver certification, all certified municipalities are eligible to apply to earn gold star recognition for achieving a high level of performance in key dimensions of sustainability. These gold star standards establish the specific actions and level of performance that support what we need to do to achieve as individual communities and as a state, which were defined in our 2015 Sustainable State of the State report. The award of a gold star indicates that a municipality is making an effective, fair, and timely contribution to the collective achievement of our sustainability goals. So the gold stars are awarded for individual dimensions of sustainability. Currently, there are gold star standards in energy, health, and water. We also plan to release a new climate readiness gold star in the very near future. And for the gold star in health, the Tobacco-Free Community Action is one of the other actions that can be completed to contribute toward earning the star. Next slide. Just some suggestions for opportunities of how you can connect with other communities around the state. So Sustainable Jersey has 10 regional hubs. These hubs help keep towns connected to each other so that green teams have an opportunity to learn and share different initiatives and projects that have been successful elsewhere in the state. It also provides opportunities for networking, connecting with neighboring towns, and working with schools to help boost resources. There's a lot of benefits to participating in one of the hubs. All of them have an online communication platform where they share ideas, ask questions, and post resources to help one another. They also hold quarterly events on a particular topic, which are open to the public. And we've also seen a mentoring program take off from the Tri-County Sustainability Alliance, where they help municipalities get certified. So if you go to the website and you see that there's a hub in your area and you're not already involved, you can certainly reach out to me and I can connect you with our hub coordinator. Next slide. So this is just a quick example of how you can use one of the features on our website, which is our participating municipalities map, to search for municipalities that are approved for different actions. So you can search by action and it'll display a list of municipalities that are currently certified and approved for that action. And you can go into their certification report and see the documentation that was submitted for those approved actions. So if you're trying to pass a policy or work on a plan and need to kind of garner some additional support to advocate for that, for your municipal staff and council and administration, using that search feature on the map can be a great way to help kind of bolster that support. Next slide. We do have a number of upcoming events and grant and technical assistance opportunities. So I would encourage you to visit the events page of our website, as along with the grants page, to get more of that information. Some of the upcoming events include numerous webinars as well as our annual Sustainability Summit, which is going to take place on May 9th at Bellworks in Homedale. And we expect to be launching registration within about like the next 2 weeks or so. Next slide. So as I mentioned earlier, Sustainable Jersey offers a grants program. The main requirement is that a municipality or a public school must be registered with Sustainable Jersey in order to be eligible to apply. So we do currently have an open funding cycle sponsored by the PSEG Foundation that's open for the Sustainable Jersey for Schools program for public schools. The municipal deadline just passed last Friday. But if you are with a municipality or if you are working with any schools, we would certainly encourage you to let them know about the upcoming Sustainable Jersey for Schools grant application deadline on March 7th. The selection committee does enjoy seeing collaboration projects between municipalities and schools. So keep that in mind. And then typically contingent upon funding, we usually offer this cycle every year. And for the Sustainable Jersey for Schools program, again, contingent upon funding, we usually have another cycle that's sponsored by NJEA, which launches in the early fall. Next slide. Just a quick thank you to all of our underwriters and sponsors who help make our programming possible. And next slide. And yeah, thank you so much for your time today, and I'm happy to answer any questions.
Thank you so much, Samantha. Thank you for that wonderful overview of Sustainable Jersey. Hello, everyone, and welcome again to our Tobacco-Free Tuesday. We have participants from municipalities and health departments, colleges, community partners. So welcome in. And you're hearing, maybe you aren't, maybe you're part of the green team, maybe you're not, maybe you're our community partners who, you're hearing about the Sustainable Jersey Tobacco-Free Community Designation, and you want to bring it to your community. So thank you, Samantha, for helping everyone navigate through the wonderful Sustainable Jersey website and all the details about Sustainable Jersey and the designation. So I wanted you to know that myself, Kim Burns, and Ashley Smith, we are part of the review team. We'll put our email addresses in the chat for all of you. So we're always here and ready to help. If you want to get started with us or you have questions about the Tobacco-Free Community Designation, we are so happy to meet with you and walk you through it. There are many ways that communities can earn points. For example, you can pass an ordinance to for a smoke-free public place that goes beyond the state law. So if you're thinking about your community, we have examples like smoke-free farmers markets and parades and concerts, and it can really be tailored to your community. Of course, a point-of-sale policy is something that is a heavier lift, and you can gain most of the points from that. And you're going to hear some wonderful examples of some communities that have done that coming up next. You can share our New Jersey, free New Jersey cessation resources, can be part of points that can be earned, and you can promote youth tobacco prevention resources with the communities and schools. And Kim, did you have anything to add?
I know we were going to mention if anyone has any questions, we're going to do questions at the end, but feel free to put them in the chat now. And then at the end of all of the presentations, then we'll quickly go through those questions. And just as Elise was saying, one of the best things that you can do is reach out to us before you submit, because we're very willing to jump on a Zoom with you and go over all the information that you have and kind of help you frame it in the best way possible. As Elise said, herself and Ashley and myself, we are the reviewers for the Tobacco-Free Community Designation. So we know what needs to be in there. So we would love to help you, whether it be for signage. I know we have some pictures of some signs coming up, but if you need signage or if you just need a little bit of direction on, how to fulfill some of the actions under, or the options under the action, then please feel free to reach out to us.
You, Tim and Elise. So now I'm going to introduce Megan Avalon from Westfield Regional Health Department. She's the Director and Health Officer for that health department.
Good morning, everybody. Today, I'm going to talk about our tobacco age of sale enforcement inspections. This program helped Westfield become a tobacco-free community designated community, and also it really helps build healthier communities as well. So next slide, please. Okay. So tobacco age of sale enforcement. In New Jersey, you need to be 21 to purchase nicotine products. Nicotine products currently does actually include electronic smoking devices as well. For our tobacco age of sale enforcement program, we focus on both traditional nicotine products like cigarettes and chewing tobacco, and electronic smoking device products as well. If a retailer is caught selling products to someone under the age of 21, they can pay a penalty of up to $1,000, and they may even lose their license to sell as well. What we do is we actually do inspections 1 to 2 times a year, and the primary goal is to make sure that these products are not sold to teens and tweens. We're also looking for flavored vapes. In New Jersey, it's illegal to sell flavored vapes, so we want to make sure that those aren't on the shelves either. And we're looking for appropriate signage. We're making sure that the tobacco age of sale sign is prominently displayed in a public area to inform the public about the law. One of the things that we do when we do these inspections is we use typically minors that are between the ages of 15 and 17. We're not looking to trick anybody. We're really looking for age-appropriate minors that really look like the age of kids that go in and maybe will be looking to purchase these products. Next slide, please. So what we know is in the last few years, vaping is in and tobacco products are out. In talking to the students, what we've learned is a lot of students don't even realize that these vaping products that are on the market are actually nicotine products. If we talk to students, a lot of times what we'll hear is things like smoking is gross, and they mean, cigarettes, right? They equate cigarettes to being gross, but they don't even realize necessarily that vaping is today's cigarette. So 22% of high school students have used an electronic smoking device, and 31% of those were able to buy those devices themselves. So why do we care about this? Well, not only are the vaping products addictive, but we're worried about something called popcorn lung or bronchiolitis obliterans. So this is a type of inflammation in the lungs that can cause really serious health effects: wheezing, coughing, shortness of breath, and over time it can lead to chronic damage. The reason this is called popcorn lung is because it was originally found in workers who worked in microwave popcorn factories, because the chemical diacetyl, which is found in many e-cigarette flavors, is also found in microwave popcorn factories, and that's what causes the condition. Next slide, please. So if we look at a timeline of what happened for the Westfield Regional Health Department to allow us to create this program, I think it's really also important to take a step back and look at the bigger picture in New Jersey as well. Years ago, prior to 2012, New Jersey actually had a robustly funded tobacco age of sale enforcement program at the state level. So what that means is New Jersey Office of Tobacco Control funded each local health department to perform these inspections, these tobacco age of sale enforcement inspections directly. However, in 2012, that funding was cut. So that means health departments had to make a really important decision. Did they continue the program without direct funding, or did they just cut the program? Like so many other municipal departments, funding is so slim, and there's so many other required things that we have to do that many health departments, including my own, had no choice but to cut the program. So going back, if you look at this timeline that I have presented here, in 2006, electronic smoking devices are introduced into the USA. They didn't really take off very robustly at first, but in 2015, Juul becomes widely available. This was a game changer for the market. Juul was marketed really to young adults and to teens, and it became a cool thing to do. When we realized this at the health department, that more and more teens and tweens were really using Juul as a nicotine delivery system, what we did is we created an ordinance, and that ordinance said that if you're selling these electronic smoking devices, then you need to be licensed. And we use that license fee to then restart and fund our local tobacco age of sale enforcement program. And if you look at 2018, by 2018, electronic smoking device use amongst minors increased to almost 21%. So in just 12 years, they were able to really, really gain traction. Next slide, please. So how effective is our tobacco age of sale enforcement program? In 2019, we had 11 retailers sell when we did our inspections. When we go in and we do these inspections, we're looking for the sale of products, but we're also doing a lot of education to these establishment owners, reminding them of the laws, giving them best practices to make sure that their employees don't sell to children without an ID, letting them know about the signage, letting them know about current laws, and really letting them know we're here for a resource. All that has really paid off. In 2024, when we did our round of inspections, only 5 retailers sold products to a minor, which is a 54% decrease in just 5 years, or 45% decrease in 5 years. Next slide, please. So the violations for selling to minors can be pretty steep, but more importantly, they're set by state statute. So these are the violations that are required for individuals that sell. You can see selling flavored vapes also have a very high penalty attached to them. But more importantly, what we remind the establishment owners is that if they are caught selling 3 times, we report them to the Division of Taxation. And then the Division of Taxation most likely will pull their license forever. So there's a really, really high incentive for the business owners not to sell these products to minors at all. Next slide, please. So thinking outside the box, how can local municipalities fund tobacco age of sale enforcement programs? Because remember, currently there is no direct state funding at this time. So as I mentioned, what we did is we started to license those electronic smoking device retailers, and we used the money for those licenses to fund our program. The program itself is pretty bare bones. All we're really doing is paying the minors who participate in the program and paying for the product. The rest of the program is kind of in-house, right? We use our health department staff to help run the program, and we run the program during the day, so there's no overtime cost. Currently, we're charging $1,000 per license for the establishment owners, but that is about 8 years old. They've been paying $1,000 for the last 8 years. So I'm looking to actually increase this year to $1,500 or $2,000. When we started this program and we started with the $1,000 license fee, it was considered very high. And I was nervous that retailers would contact us up in arms saying, this is too high of a license fee, I'm not going to pay this. But in fact, that didn't happen. What they all said was, where do I send the check? And I couldn't believe it, right? Because $1,000 was a lot of money today and back then. But then I learned what's happening is the electronic smoking device companies are reimbursing them for this license fee. So they're not even paying out of pocket directly, which is another reason why I think that the high fees that we charge can be seen as appropriate. Next slide, please. Okay, so what we have currently done in the last few years is really improve our program to really be supportive of the local municipal alliance programs and the local substance abuse prevention programs that minors participate in. So we work closely with those programs, and what it does is two things, right? It actually gets a lot of media attention after the fact, right? Because students are really, really proud to participate in this event. And it really helps the individuals who participate in our program really give them a sense of pride that they're keeping their peers safe and their community safe. The other thing that we've really done is made this a program that is really a health department-wide program. So we're using health department health education employees, our environmental team, and our nursing team. There's all a part for each of us in this program when we implement it. Next slide, please. So we went from a model practice to a true local success story. As I mentioned, our program is now financially self-sustaining. So we don't have to worry about how we're going to fund it. It's budget time now. I don't have to make a case for it. We know that the money's there and it comes directly from the licensing. The sales of these products to minors have significantly declined, and we run the program in all 9 towns that we serve. So everybody that is a part of our health department, all the towns that contract with us want to be a part of this program. So we're running this program everywhere because it's so successful. And as I mentioned, the program does enforce regulations, but also it provides educational outreach to minors about the dangers of vaping and to those stores establishments, the establishments about the changing New Jersey laws and the best practices, because at the end of the day, business owners really don't want to sell to minors either, right? They, for the most part, really want to be compliant. And then the silver lining is really now that we're funding it directly, we can actually deliver better outcomes, I think, than when we relied directly on state funding, because we're able to tailor it directly to our local needs, which is wonderful. So overall, you know, the program has been really, really successful. And, you know, I would recommend municipalities who are interested to consider trying to create their own. Next slide, please. And thank you. Any questions? We'll look for them in the chat.
Thank you, Megan. We want to just encourage everyone to please send your questions in the chat, and we will answer all questions at the end of the webinar. And also, if you still would like to receive CEU credits for participating in our webinar, the evaluation link will be posted in the chat in the end of the webinar too as well. Now I'm going to introduce Candace Davenport, who is the health officer for the townships of Maplewood and South Orange.
Hello, good morning, everyone. Thank you. Hard to follow up my colleague Megan, but I'll do my best. We're going to talk about the ordinances and initiatives addressing tobacco point of sale that allowed us to get the points for Sustainable Jersey and achieve health goal. Next slide, please. Oh, next slide. In Maplewood, we have 15 tobacco vendors and 2 vape stores. They're separated and different, and I'll get to that in a second. But just know that our tobacco vendors are the typical places. They're gas stations, pharmacy chains, 7-Elevens, liquor stores, and convenience stores and mini marts. Next slide. Back in 2023, Maplewood was able to achieve Health Gold, and it also advanced our Sustainable Jersey Silver to move up to 1 year, additional 1 year for gathering more information to when we have to renew. The two areas that we were able to get points through Sustainable Jersey are by providing information on tobacco-free communities and a smoke-free and tobacco-free public spaces. All of these are really easy to do on Sustainable Jersey. As Elise and Kim had said, they're here to help, and the folks at Sustainable Jersey couldn't be more helpful in terms of making this as easy as possible to get points. Next slide. One of the things that we have that have been really great is the Municipal Alliance for both Maplewood and South Orange. It consists of everyone from local government to your PD, your police department, your library, some partners in the school district, as well as community volunteers, both adult and youth. The Municipal Alliance is part of the Governor's Council on Substance Use Disorders. All municipal alliances receive funding from the Governor's Council to provide municipal alliance services. Some of the services that we do are after-school activities. For example, we do YouthNet, which is after-school programming and classes for students in the middle school at Maplewood Middle School, as well as community events like National Night Out. We also, through this, fund Midnight Madness or Project Graduation, which is a one night after the night of graduation, where they take the graduating seniors to a substance use free and cell phone free event, and it lasts all night. One of the things I want to mention is that our partners at the Family Connections Essex County Adapt, if you have an alcohol and drug abuse prevention team in your community, I would definitely strongly suggest that you connect with them. One of the strengths of our program is our partnerships. And I'll talk about the local ordinances later, but I definitely want to mention our Essex County Adapt partners. What they do is they have programs at the middle school as well as the high school. And at our middle school, they have a program called Youth Tobacco Action Team, and they are part of Incorruptible.us. They help to educate the students in middle school about smoking prevention and about all the things that it does, all the things that Megan had mentioned, the health issues, and all of those things, but they also talk about alcohol as well as cannabis. Participation of your middle school students in these programs empowers them. It raises awareness and education. It gives them alternative choices and becomes stronger advocate for not using alcohol and tobacco in their communities. But mostly it also increases community cohesion and a sense of belonging and support for these young students, which would reduce their risk of engaging in smoking activity. Next slide. So while Megan uses her funding of her licensing to fund tobacco age of sale enforcement, we've taken another route, which is to use our partners at Adapt, and we notify them of all of the smoking and vaping stores in our area. They then go to them and provide all of those marketing tools and educational tools on our behalf of the Municipal Alliance. As you can see, they provide them with a lot of material. These are all free. And we also work very closely with the Tobacco-Free for a Healthy New Jersey group, and I'll get to that as well. What they also do is if we have identified a location that has been rumored or suspected of selling to youth, we reach out to our ADAPT program, where they contact the U.S. Food and Drug Administration to conduct an undercover buy inspection. So the FDA will actually come out and do a TASE inspection for us, and then they will notify ADAPT, who will notify the health department, police department, once we find out anyone who has committed a violation. We do extra surveillance on them as well. Next slide. Another thing that we do in Maplewood is we look at the protective childhood experiences, as which are positive childhood experiences. We try to get this message out to our communities. We worked closely with our school district last year, as well as, this was a project through the Municipal Alliance, to get this information out to all the schools. And we created lawn signs to put them out from every elementary school to the joint high school of the two towns. We put this message out that parents who spend 15 minutes per day with their child can improve their health and well-being. We got this message through the Drug-Free New Jersey Prevention Program, which stated that parents who spend 15 minutes per day with their child can reduce their risk of using marijuana or cannabis. So we just altered that to just say just 15 minutes in general per day with your child can improve their health and well-being, to make it more generalized. If anyone knows about adverse childhood experiences, research is showing now that if a child has equal to or more positive childhood experiences, they're actually preventive and can offset any adverse childhood experiences to limit a child's risk of developing mental and physical health issues in the future. A list of positive childhood experiences are feeling able to talk with your family about your feelings, knowing that your family or your community will stand by you during difficult times, that you enjoy participating in community traditions, feeling a sense of belonging, especially in high school, feeling supported by friends, have at least 2 non-parent adults who took a genuine interest in you, and that you feel safe and protected by an adult in your home. So all of these things are preventive mechanisms that we built into our community and our community culture to hopefully keep some kids from experimentation, misuse, and eventually abuse. Next slide. So getting to the nuts and bolts, as part of our success for getting the points, were these 2 ordinances for a healthy community. In 2016, we had a regulation on tobacco and nicotine products. There's no selling to under 21, and it applied to tobacco and nicotine delivery products, including vapes, e-cigarettes, obviously requiring signage to not sell to anyone under 21, and that these were applied to all of the 15 locations that I had mentioned earlier. We also do random compliance checks. Our REHSs, or registered environmental health specialists, have to go into these locations, right? They're your Walgreens, your 7-Elevens. They have to go in there for, food inspections anyway. So one thing that we do as a best practice is we ask them to see their updated tobacco license with the state. If they don't have a tobacco license with the state that's updated, we let them know that they need to do that. It also helps them to know that we are watching, that if they do sell to minors, we can actually talk to the state and inform them of that, and they can pull or suspend their license if that's what they so choose. The enforcement power for regulation on tobacco and nicotine products is held by the health department as well as the police department. In 2020, vaping was increasing among youth, as Megan had mentioned. So we created an ordinance that regulates the sale of vaping products. If you could just click to the next slide, but it's not going to show up the next slide, and click again. Oh, no, to the backward one, sorry. Just want to say one of the unique things about our regulation or our ordinance is that any store that sells vape products can only sell vape products, vape paraphernalia, and tobacco products. That means no water, no gum, no chips, no magazines, nothing. That's why we have only 2 vape stores in Maplewood. None of the stores that sell tobacco, for example, have vapes. So the businesses balked at this. They really did. They were complaining and just, crying about the loss of vaping revenue, which was a lot, and that would damage their livelihood. We removed them from public access and view because we told them they could no longer sell it in Maplewood. And after implementation, no one went out of business due to the loss of vape product sites. So again, we only have 2 vape stores It's easier to manage, easier to see who's selling vape products to minors. And they are continually monitored both by the Maplewood Health Department and Maplewood PD. Next slide. And thanks to Tobacco-Free for a Healthy New Jersey, they can provide these wonderful metallic signs that we put up. And you can see that anyone who's done a Breathe Easy signage before has seen that it had a cigarette and a vape, but now it also has a cannabis. So it's an updated version of something you might have seen in your parks. Just note that we created back in, hold on one second. Can't remember what date we promoted this, but I think it was 2012. Yep, back in 2012, we created the local ordinance 234 regarding smoking being prohibited in public spaces. It was revised in 2021 to include the burning of or inhaling from, exhaling the smoke from, or possession of a lighted cigar, cigarette, pipe, or any other matter or substance which contains tobacco or any other matter that can be smoked, including cannabis. So we tried to reflect these new signages or other cannabis-based products, or the inhaling or exhaling of smoke or vapor from an electronic smoking device. So all to say that your ordinances will have to be, modified, reviewed. You probably already have one, but one of the things to get the point is to stay updated and abreast of all of the changes and include them in your local ordinances. And this ordinance says that you can only have at least 200 feet from a public entrance. So that's our parks, that's our recreation, our schools, our childcare centers, and things of that nature. Next slide. And that is the end of my presentation. Happy to answer any questions, and thank you so much for having us.
Thank you, Candace. So now we would be introducing Jacob Elbridge, who is the project director at Counter Tools, and he would be sharing some information with you all.
Hey everyone, as Emmanuel mentioned, my name is Jacob Delbridge. I'm a project director at Counter Tools. I'm just going to share my screen. All right. Hopefully that all looks good. So Counter Tools is a nonprofit public health agency. We work with communities all over the state of New Jersey, because we work with all our New Jersey partners all over the country, with both federal partners, state partners, and local. Let me make sure that, give me one moment. Just get this resituated. Okay, there we go. And we're a 501c3 public health consulting agency. We provide policy analysis, technical assistance and subject matter expertise, reliable technologies through things like collecting store assessment data and being able to analyze that, as well as what's called SINAR, state level compliance and enforcement data, and FDA compliance data, and aggregating that, as well as disaggregating that for our clients, and full spectrum tailored support. So the objectives today I have for my presentation in particular, but for the presentation that you have all heard in general, is, we are garnering information on local level New Jersey approaches to addressing point of sale policies, such as tobacco retailer licensing and zoning and other initiatives. We're working to familiarize ourselves with key updated data on product sales and use prevalence to support policy changes, and I'm going to get into some of those examples soon. Prepare to be able to prepare and recognize key interest holders, known as stakeholders, in this area, and what are the salient issues for each group, to understand existing perceptions of these groups, as well as some public health data grounded responses to some maybe misconceptions, and as well as to consider your current and future tobacco related policy efforts and how they may align with shared goals of municipalities, of other municipalities that may be near you or across the state, and other state level partners. So we like to say that the retail store is where tobacco enters your community. And that's because there's around $1 million per hour that are spent by the industry for advertising, marketing, and promotion in the retail environment. So the tobacco industry is spending a ton of money to recruit new smokers or people who smoke and keep current people who smoke hooked. And they're in a way sort of, buying some of that health behavior, buying youth who initiate and adults who are unable to quit. And one reason we care a lot about the point of sale is because the tobacco industry does, as mentioned, and here's kind of the proof in the pudding in terms of their expenditures. So as you see here, in 2022, the tobacco industry spent $8.3 billion marketing cigarettes and smokeless tobacco directly in retail locations. So this above, to be clear, the products that are included here under smokeless also include nicotine pouches and other kind of new emerging oral nicotine products that you've seen pop up that don't contain tobacco leaf, but are derived from tobacco or contain nicotine. And so just to be clear that this amount spent marketing directly in the retail environment amounts to over 97% of their total marketing expenditures and over 88% for their total marketing expenditures when it relates to smokeless tobacco products out of the 8.3 billion. So that very high percent spent in the retail environment. And so specifically in that retail environment, what are they spending that money on? Well, they spend the majority of the money on price discounts and promotional allowances to keep products fairly cheap, relatively, and visible at the point of sale and highly visible with things like power walls that you'll see behind the retailer. Something to note that's special to New Jersey, so a shout out, in 2020, the state passed law in the state legislature that prohibited retailers from accepting consumer coupons, price reductions, and price rebates on tobacco and e-cigarette products, including retail and online. Something to note, though, that consumer use of coupons is different from price discounts and promotional allowances paid to retailers, which is the single largest expenditure here. That makes over 85% of the industry spending as it relates to retail level advertising and promotion sales or expenditures. Of that, you can see 8.2 billion a year on those price discounts and promotional allowances to retailers. So that includes things like buy downs, off invoice discounts, voluntary price reductions, trade programs, basically contracts between some of the participating retailers and the manufacturers. But 51 million a year around point of sale advertising and signs and shelving units. And then, as I mentioned, 119 million for that consumer coupon piece a year, but not in New Jersey per state law. And as it relates to e-cigarette marketing, you'll see here that 84% of the 859 million spent on e-cigarette advertising was spent at the point of sale. So it's very similar in the e-cigarette space to the combustible tobacco and smokeless tobacco in terms of the very, very high percent of total marketing expenditures at the point of sale. And so that's why we're really talking about point of sale policies being so impactful, because it is such a highly sought after space by the industry and highly marketed and targeted environment. We know that the tobacco industry, per their own documentation, is intentionally focused on marketing to school-age youth at school-adjacent retail establishments because, as data shows, this increases the likelihood of product use and subsequent addiction. Research shows that schools with more stores within walking distance have a higher smoking prevalence among their students than schools with fewer retailers nearby. And what does this e-cigarette point of marketing buy? Similar to the question around combustible tobacco and smokeless. Well, as you can see here, quite similar, following a lot of the similar playbook. Companies know that keeping prices low drives use. And yes, the research on the impacts of e-cigarette pricing and point of sale is less extensive than the impacts of cigarette pricing. But it's seeming to, the existing data show that both disposable and reusable e-cigarette sales are also responsive to price in the exact same way or very similar way as combustible tobacco and smokeless. When e-cigarette prices increase, sales decrease, particularly among price-sensitive groups like youth and vice versa. We know that lower prices, along with coupons, price discounts, encourage youth to start smoking and move them along from experimentation to regular e-cigarette use or cigarette use. And of this sales data, who is buying as a result of this intense marketing? Well, here are some of the data points displayed here. In lieu of kind of reading those stats out to you, you can take a look. I think the themes here we see is that youth are being highly drawn to flavored products, as Megan and Candace talked about. We see increasingly frequent use among those who use e-cigarettes. So while you might see some changes in terms of the number of unique new e-cigarette users among youth come out with different reports year after year, we are seeing a very high level of youth who report using over 20 days over the last month, so 20 out of the last 30 days. So the frequent use is increasing, which is an indicator of dependence and addiction. And we know that retail sources remain a key location where youth obtain products. This data can change from state to state. Nationally, we see a 43% of 15 to 20-year-olds reporting in 2022 that they obtain their e-cigarettes from retail sources. And this, as you see, has happened even after Tobacco 21 became the law at the state and the national level. So retail sources are still a very prominent location where youth report obtaining products, basically illicitly or illegally through illegal sales. And it's also important to know that the top 5 brands of e-cigarettes among youth include both international and domestically based companies. You may have seen some reports lately in the news and different hearings about different international companies that are coming into the market. It's still really important to know that it is youth are using products that cover the gamut between the more larger tobacco industries that are US-based products and other international-based products that are maybe a little newer to be entering the market, both remaining very popular when surveying among youth use. So as Megan spoke about, really important shout out that the state of New Jersey prohibited the sale of flavored vapor products in New Jersey in 2020. Unfortunately, as with many states, New Jersey is not alone. There is an issue of compliance around that, and we are still seeing either in the state of New Jersey, flavored vapor products being sold, and in other states, even if they don't have such a policy in place, they're seeing unauthorized, federally unauthorized products continue to be sold, both to those over 21 and under 21. And just as you see here on the slide, I wanted to put a reminder, an announcement from the from the Division of Consumer Affairs at the New Jersey Attorney General, which has worked with in a multi-state coalition to try to address this issue, reminding New Jersey businesses, over 11,000 of them, through sending warning letters that selling flavored vapor products is illegal and unlawful. And so consumers that are aware of that should file a complaint and let the Division of Consumer Affairs know by calling this number listed, 800-242-5846. And there's another number listed too if you're calling from outside the state of New Jersey. And in some positive or beneficial developments, we see a decrease in the violation rate in sales to minors from state level checks, which we know of as SINAR related checks. And so that's great news after reaching nearly 26% in 2023. We see that rate is coming down somewhat. It's barely below this very important 20% threshold, 20% line for retailer violation rate. However, as you can see, there's still significant progress remaining to reach those single-digit statewide retailer violation rates that we saw back in earlier in the kind of 2010 and 2015 years. And from numerous municipality Tobacco 21 laws in New Jersey to local sales restrictions, smoke-free laws, density and proximity laws, tobacco retailer licensing, there's a strong track record and a history of local policymaking in New Jersey in the area of tobacco prevention and control. So that is really auspicious and great to see that there's just this really strong basis and history for a lot of local policymaking, local control, and local authority that's granted to many municipalities in New Jersey that have used that authority to work to improve community health and pass policies at that local level. And you can see some of these stats here, both New Jersey really leading the way in the Tobacco 21 movement to raise the minimum legal sales age, as well as numerous other local zoning laws, tobacco retailer licensing laws, and sales restrictions. And this is a very high level overview of how health officers in your jurisdiction may work vis-a-vis boards of health and health commissions and with their councils and mayors, which of course may vary in the way that this works and is effectuated in practice and carried out in what I believe is something like 564 municipalities operating under different governance models, whether Faulkner Act or not. So a lot of caveats here, which is why you see an asterisk, but I did have this reviewed by a health officer. I know in New Jersey, they said this, you know, can resonate for a number of municipalities and maybe a helpful kind of visual so you can see where you might fit in and how the different parties have roles in local policymaking in New Jersey municipalities. And here are some common examples of point of sale policies related to tobacco and nicotine products that we see being passed by the cities and counties and states that I work with across the country. That everything, as I mentioned, from tobacco retailer licensing, zoning laws. We also see minimum floor prices or prohibiting price discounts, restricting the sale of particular types of products, or content neutral advertising ordinances even, or prohibiting self-service displays. We like to map this onto what we call the 4 Ps of marketing. So that's place, product, price, and promotion. And you can see how each of these sorts of fit in each of those types of restrictions or categories or themes. So in terms of tobacco retailer licensing, which I abbreviate here to TRL, it really is one of, if not the gold standard for tracking and monitoring tobacco retailers and sales in your jurisdiction at a local level. It really is a very helpful basis and foundation for ensuring compliance with local laws, with state laws, through what can be often a budget neutral and sustainable model for a jurisdiction, as Megan talked about, when you have annual license fees that are paid, with a renewal to be able to be earmarked directly for compliance and enforcement and education efforts. So to go directly to that versus the general budget. So that really sustains that program and can sustain those inspections without relying on outside funding sources to do that and staying budget neutral. And it's important to remember that all of this is really vital to saving healthcare expenditures, which do impact local jurisdictions, if not directly, then indirectly, from federal to state to local level availability of healthcare resources, and to saving lives. It's important to remember that tobacco is the #1 cause of preventable death and disease, killing more people each year than illegal drugs and murders, car accidents, suicide, and alcohol combined. And tobacco retailer licensing supports quality local business and business fairness. So it really helps support the businesses that are complying with local, state, and federal laws relative to businesses that are not, ensuring a more level playing field and business fairness. It can create a sustainable fund source, as I mentioned, to allow that clear authority to engage in education, compliance, and enforcement activities for those local government agencies. It can help ensure that businesses that do engage in illegal sales practices that fuel youth addiction are held accountable through license suspension, revocation, and penalties that the local government agencies have the clear authority to engage in for their compliance efforts. And it helps city and county leaders, providing that mechanism for aiding the implementation of other policies as well that can fit under or be regulated through that local license. So sometimes that's other retailer density or proximity restrictions, or other policies like that can be like what Candace mentioned in terms of what particular products can be sold at what's considered a vape shop or a smoke shop, how they're defined in that local statute can be really impactful, and what other mechanisms and best practice policies that can be utilized. And it helps support teachers and staff who we know have been inundated with this proliferation of nicotine products on their campuses, which impacts student learning, teaching, and not to mention a huge material burden and cost burden for product disposal, which has become a huge concern that, if you haven't heard, you will from schools around what can we do with these products, and it is a quandary to say the least. Tobacco retailer licensing also means, a greater level playing field among other types of licenses for sellers, such as products of alcohol, cannabis, and or food. Often they are required to have local licenses. And so a lot of the question is, why would tobacco products be different? And it so creates better uniformity. It reduces health inequities. We know the tobacco industry is engaged in these targeted sales practices to more vulnerable communities, and that uniform licensing requirements allow residents and taxpayers to benefit more evenly from city and county programs that can be funded through license fees to better protect and promote that community health and wellness that all can benefit from more evenly at a citywide or a townwide level. And, you know, it helps local jurisdictions better understand where and how these products are sold in your communities. When there are compliance efforts, education efforts, you can better see what's on the shelves, better know, you know, where and how, and the different practices that are going into place and you know, local levels. And this can really be different depending on the local jurisdiction you're in terms of how that interaction can work between the manufacturer, the wholesaler, the distributor, and the retailer. And there's a lot of interactions that happen not visibly, or at least able to be found through online searches, for example, that you really do need to go into the store to see and learn from and have conversations about. There are also zoning policy considerations. So this is something we've seen increase substantially among cities and counties across the country, where local officials are very concerned with both the health of their downtowns, the health of youth, and they're working on passing laws and instituting policies around distance and proximity to schools, parks, childcare facilities, distances or density requirements of total types of vape shops and smoke shops in the town to better regulate the proliferation of these stores in their neighborhoods and in their communities, just like you would have other city zoning and county zoning that works to ensure that there's a good balance of types of businesses and services that are taking up important real estate within your city in zoned areas of what are commercial areas. And actually, over the past 4 legislative sessions, the state has worked to try to prohibit tobacco and alcohol advertising within certain distances of schools. So at the state level, there are some efforts around that advertising. However, it hasn't taken effect. It has sort of stalled out, and a lot of that zoning work is at the hands and is under the authority of counties to do. And so zoning is oftentimes done at that county or more local level. So you might not see a lot of efforts around zoning at the state, which is why a lot of locals are picking this up. And actually, I've been conducting a pretty in-depth analysis of New Jersey's municipalities zoning ordinance that have passed so far. I hope to be able to present that later in a future webinar. But to give an overview on what some of those policies can look like in the way they're structured, they can be applied to, for example, all fixed location stores, brick and mortar, that sell tobacco or nicotine. That might seem like a no-brainer, but why I differentiate that is because we are seeing also many mobile trucks, trailers, and vans that are popping up. It depends on the state, it depends on the environment, again, as I spoke about, but in certain states, we are seeing this become a very big issue, particularly around college campuses and other areas like that, and they become quite hard to regulate if only being able to use a VIN number. So there are other efforts to try to work to zone both mobile and fixed locations. Some of the zoning laws are basically defining vape shops, smoke shops, tobacco shops that need to be compliant with their designation and with any restrictions, and that designation is made dependent upon the percent of revenue they get from sales of tobacco or nicotine products. So it basically be applied maybe potentially not to all stores that sell these products, but those that sell above a certain threshold, or that have their products occupy a certain amount of the floor space in their store above a certain threshold. So you're seeing locals try to take this approach that makes sense for their communities to ensure small businesses that maybe have been in their neighborhoods for a long time and that sell other important products in their stores that the community relies on can still be there, while the products that they may sell or the stores that really offer very little healthful benefit in terms of the products that they sell may, to kind of better distinguish that from a small business perspective. And then why retailer density matters? Well, when more tobacco retailers are located in an area, we know, residents' health suffers, youth are more likely to start smoking, people who smoke consume more cigarettes per day and have a harder time quitting. And we see lots of disparities, around by things like socioeconomic status and income. For example, two areas here, pretty significant differences in income, and also pretty significant differences in tobacco retailer density. And this kind of trend and pattern is quite common when you look at jurisdictions that have higher and lower income and how that impacts their tobacco retailer density usually sorts of follow suit. In terms of salient framing and arguments, it's something really important that when I work with communities comes up a lot, is thinking about when you're talking with community members and decision makers, what are the convincing reasons and frames for doing point of sale policies in your community? And that can look different depending on that community. So for some, they're really concerned about youth and young adults and nicotine addiction and tobacco dependence. For others, that might be an important element, but they're also really concerned about a healthy and vibrant downtown from a glut of tobacco and nicotine products that might actually be pushing out other types of businesses because of the real estate they're taking up in potentially these very small towns with small amounts of commercial zone. Creating parity in licensing for equity purposes or equality between alcohol, food, hunting product licenses, and to better understand where these products are sold, create a pathway for education, better oversight at the local level, particularly when locals may not feel that level from, for instance, being able to have as much federal presence, for example, on inspections or things like that they may like. Responding to concerns and perceptions that people may have, are people concerned about more government regulation? And if so, have you been able to talk about how tobacco retailer licensing can bring licensing parity, how those fees can directly and solely be earmarked for compliance? Are there concerns around or perceptions around the disagreement of existing issues of noncompliance, thinking that noncompliance isn't an issue? Well, are you able to highlight some local, state, national data that may corroborate that or dispute that? And some of obviously the national data and some state level data points to some very concerning trends that continue around accessibility of these products in a retail environment. So illegal or illicit sales, noncompliance. Detrimental impact of licensing fee on small businesses. Well, Megan talked about this a little bit in terms of the licensing fee and some ways that's being offset potentially by the industry and others. And then in terms of the profit margins, we know that 22% gross profit margin for smokeless, which is like nicotine products, and there's a 33% gross profit margin for e-cigarettes. That's quite large if you compare that to any type of other product and the profit margins you can garner. So a once annual license fee is pretty negligible, even in the thousands, when you think about what the profit margins that they're gaining from these products are. And then are there disagreement about the dependence level among youth in the community, thinking, well, our national data might show that there's somewhat of a downward trend. We're moving from this issue. We know that there's oftentimes a migration from these products. Now Zyn types of oral nicotine products, Velo, all these other brands are gaining a lot of shares. So maybe not e-cigarettes, but other addiction products that are addictive, nicotine containing. We see that, as I mentioned earlier, frequency of use can be increasing. And then also the products themselves are changing quite rapidly. Is there being data put out for your local leaders around the most popular e-cigarette products, particularly disposable products now, have tripled in nicotine concentration, quadrupled in their e-liquid capacity, and decreased in price by 70% over a 5-year period. And that's an enormous change in the pricing and the content of these products. So they aren't stagnant products. They're evolving with the markets, and they are becoming more and more potent and concentrated. And you just wanted to sort of leave you in the last couple of slides with a brainstorming worksheet. So as you work to identify partners in your community, thinking who to get involved and who should I include on my team, this might be a helpful worksheet. Really, it's quite simple and rudimentary, but just to get you started in thinking who are the traditional partners, who are maybe the folks in the groups that I haven't traditionally engaged with. These might be people of your potential green team or other just advocates and partners that can help make cases and document information for you and really elevate some of the issues that you see. We like to talk about this as part of the policy change process. So just stepping back a little bit, knowing how policies being implemented are just maybe one of the end levels of a pretty circular policy change process of first documenting the problem, formulating solutions, raising awareness, and then evaluating that policy once it's implemented to see how it's working. We oftentimes see store assessments fit into the documenting the local problem stage. And on that, I think it's worth mentioning this really important statistic that really motivates a lot of the work we do and helps, kind of empower us to continue doing what we do, which is, the act of collecting and sharing this type of store assessment data can really be a catalyst for change, showing that with this research showing that counties across the country that have conducted store assessments were actually around 6 times as likely to have adopted a point of sale ordinance compared to those who had not. So really, you know, that data collection, it engages people in the work, it makes it tangible, it makes it visible, and it provides important justification that local leaders need to back up and provide the data they need to make a policy change on. Both for legal reasons, for getting a groundswell of support, and for making a sound decision that's as data steeped as it can be. And I know NJPN and Tobacco-Free for Healthy New Jersey have store assessment tool resources that they are promoting, that folks here on the call can take a look at and hopefully complete in their neighborhoods to help build up store assessments as you can in time. And just with that, wanted to say thank you. This is my information here at Counter Tools. And also wanted to then finish off with the information specifically on the emails and names of the Northern, Central, Southern Regional, and overall tobacco program supervisor team for Tobacco-Free for Healthy New Jersey. So you can get in touch with all the folks here on the call. You also have that slide information for Megan and Candace. And at that, I'm going to stop sharing. Thank you for bearing with me on my tech startup here as we shift who presents who presents which slide deck, and I think it worked out. And at that, I'm actually going to turn to a moderator role and open it up for questions for our last 15 minutes or so. So I'm going to take a read through in the chat. Please, anyone who would like to, you can raise your hand and I'll call on you, and then you can come off mute and ask your question live. Yes, I can share my email in the chat here too. So we see one question here around from Elisa on, do you know of any labs that test for tobacco nicotine content? We've had a case where they wanted us to prove that the vape product had nicotine in it, despite being listed on the packaging. Maybe not being listed on the packaging. That's a great question in terms of labs that do that. It's not my area of expertise. Maybe someone on the call locally has a little bit more information on that. I can also follow up with more resources. Emmanuel, you have any thoughts on that?
I answered Lisa in the chat, but there is a company called LabStat where you could send tobacco and nicotine products for testing. The only thing is that they request a quote because they require a fee. So that's one company that I do know of. But if anyone would like to share more information about this too as well.
One thing I'd like to add that state law defines electronic smoking device as anything that can be smoked electronically, regardless or not whether there's nicotine in it. So, you know, we always default to electronic smoking device, regardless of whether or not there's actually nicotine in it. It still falls under that 21 and older to purchase.
It's muted there. We have a question here. Are the ICE branded vapes considered flavored? This is a great question that I know comes up a lot in states, and I turn it over. I'm not that steeped in the specific language about how flavors are defined in New Jersey, but it is a question around basically what we would consider concept flavors like that, which don't directly constitute or signify a flavor, but are, for all intents and purposes, usually flavored to potentially, in this case, sort of a menthol or a mint profile. So I don't know if folks on New Jersey have experience with concept flavors in New Jersey and fielding that.
Do our health officers have, I just wondered if our health officers have some thoughts about this, if you were, you know, inspecting for flavored products. Or your teams were?
Yeah, I believe that you know, the state regulation says any flavored vape, including menthol. So I know that there's another brand called Clear. It's not clear. It's still flavored. Those are not allowed either.
Yeah, and if you're not sure what we're talking about, concept flavors, right? They're not real flavors. You know, like ice, we know isn't a flavor, but just a way to use language to, it's still a flavored, it might be the ice is minty, but it's just trying to create flavors that get around, you know, the flavor law. I know, is there anyone else on the team want to jump in?
Yeah,
good question too, by the way.
Yes, considered basically sometimes it, you know, considered menthol or minty flavor. So I mean, we know that menthol e-cigarettes are banned in New Jersey. So,
Yeah.
that's the answer to that. Mhm.
And I actually pulled up the statutory language too, which talks about what they call characterizing flavors. And, according to state law in New Jersey, it does say it has a distinguishable flavor, taste, or aroma, including but not limited to all of these things. So it's a quite broad and I think all-encompassing and comprehensive definition that really gets to anything that has a distinguishable flavor, profile, aroma, taste, that other than tobacco. And so, speak with your local attorneys and experts on that. None of us here are providing direct legal guidance, but looking at the language definition is a pretty I would say one of the strongest definitions and broadest definitions for what a flavor can be constituted as. I've seen some others much more restrictive in terms of how flavor is defined, and so that can be hopefully helpful in your public health work and making a case.
Just real quickly, once again, I sent the evaluation link for the CEU credit. So if you have the opportunity right now to just fill out the evaluation link, so you can receive the CEU credits. And I will be sending a follow-up emails to everyone on the webinar, the evaluation link as well, in case you don't have the chance to fill out the link right now.
Yeah, I see some other questions too around some other types of flavors, specifically around kind of Havana tobacco flavor, Dutch tobacco. I think probably for the interest of time and moving to making sure we cover other areas, I would love to follow up with you too directly. I think I also need to investigate that a little bit more to better understand that. So I would say contact really any of us with those specific questions that you see, because as you can imagine, as you're seeing, it could be an extensive conversation going through all the different concept or variations of flavor profiles and how they may be compliant or non-compliant with state law.
And depending on what type of product we're talking about too. So probably an offline conversation is warranted there, because we could talk a lot about all of that. But great questions. Thank you for your questions, everyone.
Please keep them coming in the chat, or feel free to raise your hand and I can elevate you, or you can come off mute. While folks are thinking, I actually did have one prepared because I was really curious to hear from Candace. I know in your Sustainable Jersey application and profile, it talks about your participation in the City Health Dashboard, along with about a dozen other New Jersey municipalities. And I was hoping you could speak to that for some of the other municipality staff here about how that's aided your work and what they might want to know about it and how that data can be helpful.
Thanks, Jacob. So there are several cities and towns that have participated in the Put Us on the Map challenge that allows you to have access to the City Health Dashboard. What the City Health Dashboard information does is it's a website that can provide you with at least, I think, 40 public health indicators by census tract in your town, and one of those is smoking. So it'll tell you by census tract, thank you, where you have more risk of smoking, more risk of asthma. And then what you can do is overlay that as a local health department with the stores that are licensed as tobacco or vape stores. And you can then see, is there a correlation to, a densely populated area perhaps, or that they are closer in proximity to people who have filled out, national surveys or state surveys that said, we have, I've smoked for, more than 20 days, I smoke frequently. So you can see the difference throughout your town on many various topics, including smoking. I would highly recommend every local health department getting on this. It's free. All you have to do is put in an application, but the data that you get is phenomenal. And then you can present it to your local governing body and just show them, like, look, when we create policies or when we create zoning, this is what's happening over here. Not that there's a correlation or a causation, but just that these two things are happening at the same time.
That's great. Thanks so much, Candace. And for folks who might be listening on the phone or haven't looked at the chat, I put in the chat the City Help Dashboard link with the specific example for Maplewood Township. And I also see a question below from Pia around, has there been a rise in chewing tobacco products at all with so much focus on vape and smoke products? And then there's a follow-up from Sharonda around Orz-in pouches. And so I think that really has helped lay my answer, which is the data that from the National Youth Tobacco Survey coming out from 2024 and some of the other latest health surveillance system data is showing definitely a rise in nicotine pouches or other what's called new or oral nicotine products. In fact, they are now outpacing or have a higher use of prevalence than combustible cigarettes do among youth. So you are seeing sort of this switch and this trend towards those products increasing. I haven't seen the data show that like dip or chew products that contain tobacco leaf are increasing a lot in youth use from years prior, but the Zyn style products, the oral nicotine products, nicotine pouches, some of which claim to have tobacco-derived nicotine, some which claim synthetic nicotine, it's all over the map, but regardless, these are nicotine products and oftentimes tobacco products in the same way, particularly if they're verified as being derived from tobacco leaf. And they are increasing pretty significantly among youth use, oftentimes for some of the ability to, reportedly among youth to be able to use it in more places, you could say more discreetly, and not produce any vapor or aerosol emissions. And in fact, a lot of the industries are using the words quote unquote discreet and other elements to specifically market their products in that way to gain appeal among their consumers. You could say intentionally for those who are adults, that language gets to all ages and has appeal among all ages.
I know Emmanuel just put in the chat the FDA site. This is a really good resource. If you want to know what's going on in your town, and especially if you're going out and doing those tobacco assessments, then you can just put your zip code in. I always leave the date blank, and you can see what stores have gotten warning letters, what have had to pay fines, and it's just a really good resource.
Yeah, and thanks, Taylor, for your question, and thanks, Megan, for responding in the chat around offense violations and fine structures and fee structures. Any other questions? We have just a couple minutes before the end of the webinar scheduling. We do have an evaluation again. I think Emmanuel said he put it in the chat. I can try to grab it again.
Just have a question for Megan. Megan, those are local fines that you have? Because this was a discussion that we were having and we couldn't find anything statewide. So.
No, those are statewide. I can actually get you the statute. I don't have it.
That would be wonderful. Yeah, because I was recently in South Carolina, and I don't know if everybody's familiar with sticker shock, but it's for alcohol. You go in and the youth put like these very colorful stickers on the alcohol stating the fines. And South Carolina actually had like things on the doors similar to that, saying what the fines were if people sold to underage or, that whole reselling thing. So that's great. If you could send that along, Megan, that would be wonderful. I know Lynn had a question about flavored hemp vapes on the shelf.
Yeah, I think more conversation is needed around that. We do know that given some loopholes to the federal farm bill, we are seeing hemp products or kind of cannabis-derived products hit the shelves in various states, and that's sort of probably a webinar all unto themselves. And I imagine, locals have a lot of different perspectives and ways that they're using existing policies and efforts and structures to be able to address that, some of which might be sort of applicable to the regulations that we talked about today, some of which might not, because we're talking about different products. And so, but we are talking about things like vapes. So there is some overlap, some intersection. And I think we can definitely follow up.
I think we also heard earlier that, you know, just this overall, if it's flavored, right, it doesn't matter, you know, and it's electronic, it's not legal, you know,
Right.
you know, yes.
Exactly.
Because I know,
Yeah,
yeah, but because we hear that a lot, right? We know there are a lot of different flavored electronic products that aren't nicotine-based products, but just the fact that they are flavored and electronic, the way the law is written, they should be covered.
Manuel, I don't know if you saw, Mark said he was having trouble opening the evaluation link.
Let me check that real quick.
And then Pia had a question about educational resources on smokeless campaigns to share with schools. I know there's a few slides on our updated Don't Get Vaped In presentation that we do. I don't know if anyone else has any other additional resources. I know it's a growing area, definitely a growing area of concern. So I know that, you know, our team is, you know, working and looking specific to pouches if they're available. Okay. Yeah, Pia, if you want to reach out to one of us, then we can share what resources we have with you.
Oh, and thanks for Lama. Apologize if I mispronounced your name. For putting the information in there about the state level violation structures and potential revocation and suspension of license. Ashley mentioned they're creating one-pagers and brochures around nicotine pouches, and we'll share that education materials when they are ready. And so that's Ashley Smith from New Jersey Prevention Network, Tobacco-Free for Healthy New Jersey. And we can, yes, Mark, I think we can follow up with the evaluation link after in an email, and that might be easier in case there's any access issues. And yes, we would love to get your feedback. Flavored, yes, Adam, to your question. Flavored e-cigarette products are illegal in New Jersey to sell.
Yes, they are not legal, and the Attorney General sent out 11,000 letters to
Yes.
really reiterate that, right? They are unlawful, is what the language of the letter said.
Yeah, and I'll even re-put in the chat here too the information I had on my slide about direct information from the AG's office on what they're asking for locals like yourself to provide them in terms of information and tips for if you see this in the stores, so they can follow up through their Division of Consumer Affairs.
Yes, and you can also always report to the FDA.
Right.
If you do report a store, they have to come out and, you know, make a visit. So, you know, and we all know, those of us doing this work, that these products are still very prevalent in the stores. And that's why we're so appreciative of our presenters today, sharing the information about what's happening at the community level, how you can get involved through Sustainable Jersey, which I think makes that lift a little bit easier. We know policy changes, you know, it can be a big lift. It doesn't happen so quickly. But these are all together, all these, you know, practices. The goal is healthier communities, especially protecting our youth. It's a great questions, conversation. Thank you, everyone.
Great. Thank you all so much. Thanks for staying a little longer. And I know this recording will be available, and please reach out with any questions. Thanks for joining.